Hi, my name is Tom Turner. I am Dr. Lloyd Hayes' research assistant. Dr. Hayes is an orthopedic surgeon specializing in spinal deformity and has been in practice for over 20 years. Today I will be presenting on surgeon leadership for improving quality and decreasing costs in the clinic and operating room. This talk was also presented at the NAS conference this year. Now here's an overview of our talk. We will be discussing our motivation, research, and implementation. There are several mentors that have impacted Dr. Hayes' perspective on quality in healthcare. One of these mentors is a man named Satya Sharma, who's a Deming Award winner. Satya introduced to Dr. Hayes the idea of going lean in production in order to improve quality. An experience that sparked Dr. Hayes' awareness about the cost of spine surgery was an event in 1999. After doing a very long, complicated 8-hour surgery, a representative of the hospital asked him, "How much money did you lose from me in surgery today?" He was surprised to hear this and began to research the costs involved and discovered how high the cost of a lumbar pedicle screw was. Before this, he was generally aware but did not pay much thought to the total expenses involved. Now, some powerful books that have impacted our clinic's foundation on the relationship between quality and productivity are Out of the Crisis by Edward Deming, which looks at two central issues facing the industry in the 1980s. Second, The Machine That Changed the World by James Womack, which is a book based on MIT's 5-year study on the automobile industry, especially Toyota's lean production strategy. And then The Fifth Discipline by Peter Senge, which teaches about systems thinking and the idea of metanoia, which we'll take a look at later. So I'd like to take a moment to look at an issue called the system effect. Here in the system effect, you are the spine surgeon. As a surgeon, you are making decisions every day while treating your patients. Because your patient is precious to you, your decisions are always done in the best interest of the patient to increase their quality of life. What we as surgeons do not often think about, though, is how our everyday decisions also affect our society as a whole. And this has a ripple effect that includes hospitals and vendors in the purchasing and use of surgical resources, also payers like private insurance companies, and our government with Medicare and Medicaid. Even employers are greatly impacted by rising healthcare expenses, which influences the quality of health benefits that they are able to provide to their employees, which in turn affects the next generation and hinders our current and future patients from getting access to the treatment they need to have a better quality of life. This is why focusing on the value of our care is very important, especially for me as I think about my career as a future physician in our current healthcare system. And the concept of value is not limited by time, because value takes into consideration both the quality of our work and the expense. But how would you define quality and cost in spine surgery? Peter Drucker defines it as this: quality in a product or service is not what the supplier puts in, it is what the customer gets out and is willing to pay for. Peter Drucker reminds us that the patient's outcome and the affordability of our services are key to the value of our care. Even with the significant improvements in patient outcomes over the years, if the cost is too high that patients cannot afford our service, then the value of our healthcare diminishes. As stewards of healthcare, we are responsible for its protection and preservation. And so as physicians, we often have this tension between making the best decisions for our patients and for society. Thinking about how to steward healthcare well, I want to introduce the idea of metanoia and thinking about a lean mindset. Some of you may have seen this popular drawing before, but I want you to tell me what you see. Do you see a young lady or an elderly woman? Just by switching your perspective, you may be able to even see both. And this is what metanoia is. It is a shift in one's mind and direction. It is a change in how you view caring for your patients, your role, and responsibility in the decisions you make and how they affect society. Now, one of the ways that we implement metanoia in our clinic is by having weekly quality meetings, and we have coined a term called ELI, which stands for Error, Learn, Improve. Now, this keeps our staff focused on continuous improvement and facilitates a healthy perspective on how to learn from our mistakes. This is a visual example of how value improves as we learn from our errors. From the front desk to the surgeon, every staff member is able to improve value for the overall patient care experience by using our simple ELI system. Every week we have a staff meeting and often discuss 3 to 4 ELIs. If you think about how there are 50 weeks in a year, and that the Hay Clinic has been implementing this method for 10 years, which means that since the founding of the Hay Clinic, we have implemented over 1,500 ELIs into improving our value, and there is still much to learn. Deming talks about how this is important for enabling the employees because it gives them responsibility and purpose in their work. Now I want to take a moment to introduce a survey study we conducted in 2014 on surgeons from the Scoliosis Research Society regarding spinal surgery cost awareness and willingness to improve value by reducing waste. You can see from the map that we had 199 respondents from a variety of nations. From our study, we found that the majority of surgeons chose the intraoperative phase of care as the one with the highest cost, potential for change, and area of greatest surgeon influence or control. And the recipe for a significant impact on healthcare consists of high costs, high variation, and willing decision makers. Through our study, we were able to show that spine surgery includes all 3 characteristics. Surveying the estimated cost of a polyaxial lumbar pedicle screw for each surgeon, we were able to create this graph that shows a high variation in costs for a screw that is about $50 to manufacture. We found that prices varied between less than $200 to over $1,200 per screw. Screw prices were determined by the hospital for all the U.S. surgeons except for one. In regards to a 14-segment 27-screw scoliosis surgery, the cost variation in a pedicle screw can lead to over a $20,000 difference for the same procedure. This figure shows the percentage of surgeons that have taken specific actions before the study to increase cost awareness and reduce waste. It also shows what surgeons are willing to do the following year. You can see that there is much that has been done and is willing to be done by SRS surgeons in order to reduce waste in our current healthcare system. Next, I want to talk about the idea of streamlining. When you think about the word streamlining, I want you to think about removing all the obstacles in a pathway to create a steady flow. Taichi Ono, who streamlined the Toyota production system, said, "Reduce the timeline by removing non-value-added waste." Here's an example of the automobile manufacturing process. You have the supplier who transports the parts to the factory to be assembled. Once the parts are available, you have the chassis, axle, engine, etc. that are put together to create the finished product. The automobile undergoes some performance testing, then it is sold to the customer. It's important to note that the flow of materials proceeds to the right, while the flow of information originates from the customer. In healthcare, our product is service. Our service consists primarily of making decisions for our patients. Here is a visual example of the multi-step process involved, from appointment registration, to outpatient visits, to surgery booking, to surgery, then hospital stay, and follow-up visits. Streamlining our care allows us to deliver excellent value to our patients by learning how to eliminate waste along value streams, which will reduce costs and optimize resource effectiveness. An example of streamlining in our clinic is that we have multi-level therapy for our outpatient care. We have level 1 therapy, which includes weight loss, physical therapy, spending enough time with our patient, educating our patients, consistent follow-up, and watching out for red flag signs. Our level 2 therapy involves getting additional imaging and ordering injections for our patients. To note, there is some current controversy over the effectiveness of steroid injections. For level 3, we have determined that the patient is fit for surgery with a progressing curve and a decreasing quality of life. We always have our patients complete an informed consent before we do any surgery. Then for inpatient care, prior to the operation, all our patients undergo pre-anesthesia testing. We are persistent on surgical clearance and making sure our patients have an emergency contact or caregiver for post-op care. Also, our clinic staff meet weekly to review and evaluate upcoming surgical cases. To minimize waste during surgery, Dr. Hay has trained a team that he works with in the OR. He also seeks to prevent infection, reduce surgical time, use the best implant insertion equipment, and stick to only the necessary amount of implants and biologics. He also has sought to minimize the cost per implant device by negotiating directly with vendors, which I will go into more detail about shortly. Then post-surgery, it is important to think about hospital stay time, discharge education, rehab, and wound care in regards to staying lean and eliminating non-value adding waste. Going completely lean doesn't just involve the clinical and surgical aspects of care, but also the administrative processes in the clinic and hospital. For our office, we have a customized process control information system called Aqueduct, which allows us to have rapid appointment requests for patients. We also have weekly quality meetings to promote value improvement with an Eli mentality throughout the week. And one of the biggest ways we go lean is through our teamwork and training our members with the ability to cross-cover teammates. An example is how the automobile assembly lines differ between the traditional Western companies like Ford and the Japanese company Toyota. In the traditional Western team model, each station has their own task to complete, then pass on to the next station. Station B waits for Station A to finish, then it finishes its job and passes on to Station C. If Station A is running behind, that creates a tripling ripple effect. So to remove waste and maximize productivity, Toyota trained their workers to help each other. This is the method we use at the Hay Clinic, and it improves our quality by allowing us more time to focus on the patient. Another initiative in reducing waste in the operating room has been by reducing the cost of implant devices. There has been research studies done on decreasing the number of implant devices utilized during surgery, and that has helped lower unnecessary implant waste, but there is still the issue of cost per implant device. To take action, Dr. Hay has worked directly with vendors to negotiate implant prices to a reasonable rate. After 15 years, his vendor negotiated prices are still significantly lower than the majority of hospital negotiated rates. And there have only been 2 instrument changes within the past 10 years. In selecting which system to use, the first factor is always based on whether these new instruments will improve patient outcomes and quality of care. Although it can be difficult to measure patient outcomes over a short amount of time, other factors that influence quality are improved surgical time and deformity correction. As you can see in the graph, Dr. Hay, as a surgeon, is the decision maker for his patients and was able to greatly improve value by negotiating high-quality implant devices for lower prices. That creates more affordable, high-quality care for his patients. I do want to note that even if quality improves while cost remains the same, or if cost decreases while quality is maintained, then value is still increased. And here is a visual example of our experience regarding implant price negotiation. 6 years ago, Dr. Hay decided to work with a specific vendor to negotiate lower implant prices, and per surgeon began to save the hospital $2 million a year. At that time, the hospital was still purchasing implant devices from several vendor companies based on the choice of multiple surgeons. After 5 years, in an effort to lower expenses, the hospital hired financial consultants to help initiate a significant cut in the number of vendors they would purchase implant devices from. An important factor involved in the decision was the implant price. Our surgeon negotiated vendor prices are still less than half the price of the hospital's negotiated rates, and saves the hospital between $600,000 to $700,000 a year. Therefore, the hospital continues to make purchases from our vendor and 2 others. You can see from this example that when surgeons, hospitals, and vendors work together, everyone wins. Collaboration between stakeholders towards the same goal of offering value to our patients results in a system benefit. Decreased healthcare expenses should lead to lower insurance premiums and lower costs for high-deductible plans. Decisions are being made more specific to the patient because the physician is helping to set those prices. The hospital's margin increases, which provides job opportunities and resources to serve the poor. Vendors are still able to profit from the purchases and maintain surgeon partnerships. Insurance companies receive smaller claims to cover, promoting better premium rates for their customers by bending the healthcare cost curve. The national budget and economy also benefit. The effect continues on to our employers as they spend less on healthcare, which enables them to give better benefits to their employees and generate more net revenue for business. Thinking about our future, the next generation will hopefully have an affordable, high-quality healthcare system that they can depend upon. This is the impact that simple decisions can make. So what did we learn today? We talked about how increased value and the ultimate goal, surgeon decisions affect the whole system, our responsibility to preserve and protect healthcare as stewards, how to develop a lean mindset through Metanoia and Eli. We also discussed a recent SRS survey that shows the high cost and variation involved in spine surgery and the willingness of our surgeons to take action in eliminating waste. I showed you how our clinic has been streamlining outpatient and inpatient care. Also, Dr. Hayes' personal story implementing lean methods by negotiating implant device costs directly with the vendor. Here are some recommended next steps for going lean. Think about if change comes best through controlling MDs or enabling them. If you are a hospital administrator, how can you enable your surgeons? How can you take initiative in developing a lean mindset in your practice? Being a member of NAS, how can this society help mentor you in implementing lean value care? Some ways are through best practices, research and reading, and even other colleagues as mentors. Yet my highest recommendation is to just start trying. Try to introduce a weekly quality meeting, an Eli mentality, and create constancy of purpose in your practice or institution by focusing on the value of lean care. But most importantly, seek to motivate others by your own leadership. And feel free to contact us for any additional correspondence. So that is all that I have for this talk. I want to thank you so much for listening.